global health policy expert and the managing director of the consulting firm, the High Lantern Group. Mario, thanks so much for joining us. This inconclusive report seems to support the WHO, which says we may never find out the origins of this virus. Is that a fair assumption?
Good evening. Thank you for having me. Yes, it is, as you noted, this task is proving quite challenging. And it is not a trivial task if you consider that the origin of the HIV virus were basically only discovered 20 years after, and we're still kind of struggling in figuring out the Ebola. What is sure, though, and I think the report and the news from today, it's a significant news, let's say, is that the window of opportunity for conducting this inquiry is actually closing very fast because the evidence has been corrupted. You know, this happened a little bit of time ago. And so let's say, we are at a critical moment. And of course, the quest, like the search for this has to be balanced as well with the current situation in which we live. And we're still in a pandemic.
Sure. I mean, given, though, that we may not be able to determine the origins of this virus, there is a degree of blame being levelled at China. Is that justified, in your opinion?
I think, in this kind of processes, and it is a great lesson for the next pandemic, we should work on the principles. We need better cooperation. We need better access to raw data. We need to have transparency, so government to be open and cooperative. And I think, in this case, it has to be recognized that at the beginning of the pandemic, most of those values, or principles were not there. So definitely there is a lesson learned there. What I will say, though, is that the blame game that is kind of happening right now has been and also remains a distraction from the essential work that needs to be done to actually control the pandemic. It is important to figure out where this is coming from, once again, because it will really help us learn. But on the other side, there is quite an urgency, right, when we look into what needs to be done in several countries. So there are good reasons, but once we figure out where the virus is coming, well, it will help us for the future, but it will not help to resolve our current situation.
So would you say stop the blame game and put their energies instead into vaccinating the rest of the world, given nearly 4.5 million people are dead and so many of the world's poorest are yet to receive even a single dose?
Absolutely. I think vaccine inequity is the biggest obstacle at the moment. When you look into poorer countries, there are a vast majority of them have not been able even to vaccinate health workers and risk population. And this scenario in the Western world seems far away, right? In our countries, I will say, many developing countries will not be able to come back even before 2024 to pre-COVID level when it comes to the epidemiology and to the economics. I think there is definitely that, but also in the countries where vaccination is already ongoing, there is a strategy and there is some cooperation needed, because it's most likely that those countries and the world in the end, we will reach a different epidemiological endpoint compared to the herd immunity. This will become something that we will live with, right? It becomes endemic, and the societies will need to decide from time to time, basically, what's the threshold, right? Do we need to care about the numbers? Do we need to care about, making sure that people don't die? So we concentrate our efforts in the acute phase. And to take all this decision, you need cooperation. So you need stop the blame, but you need cooperation. You need, principles and guidance. And so I think, there are a couple of things that I would, from my little, I would suggest. I think there is a lot of efforts into ramping up surveillance of new variants. Today is news of a new one coming up. We need to support innovation, also in vaccines, in therapeutic, but I would say in particular in better diagnostics and faster and more reliable. And also we need to continue tracing, and we need to also act on the communication level. We need to commit to foster inclusive rather than divisive discourse on how the society is actually handling that, while waiting, of course, for immunization rates to ramp up.
Yeah, there's some great suggestions there, Mario. Thanks so much. Mario Ottiglio joining us live in Geneva. Thank you.